The lower back, also called the lumbar region, is the area of the back that begins below the rib cage. Almost everyone suffers from lower back pain at some point in their lives. It's a leading cause of joblessness in the US. Fortunately, it often gets better on its own. When this is not the case, you can ask for professional help. Symptoms of low back pain. These can range from a dull pain to a stabbing or stabbing sensation. The pain can make it difficult to move or stay upright. Pain that appears suddenly is sharp. It can occur during sports or lifting heavy objects. Pain that lasts more than 3 months is considered chronic. The culprit behind back pain. Your job if your job involves lifting, pulling, or anything that twists your spine. It can contribute to back pain. However, sitting at a desk all day comes with its own risks, especially if your chair is uncomfortable or you tend to slouch. The culprit behind back pain. Your bag. Although you can carry your purse, backpack, or briefcase over your shoulder, it is your lower back that supports your upper body, including any additional weight you are carrying. Therefore, an overstuffed bag can strain your lower back, especially if you carry it day after day. If you must carry a heavy load, consider switching to a wheeled briefcase. The culprit behind back pain. Your posture. Moms were right when they said, stand up. Your back supports weight better when you don't slouch. This means sitting with good lumbar support for your lower back, shoulders back, and feet propped up on a low stool. When standing, keep your weight balanced on both feet. Who is at risk for low back pain? Most people first experience back pain in their 30s. The chances of having additional attacks increase with age. Other reasons your lower back may hurt include being overweight, be sedentary, lifting heavy things at work. Care to treat for low back pain. Back pain due to a muscle strain usually gets better on its own, but you can take steps to make yourself more comfortable. A heating pad or warm baths may provide temporary pain relief. When your back hurts, you may not feel like getting out of bed. But if the problem is a muscle strain, doctors recommend returning to normal activities as soon as possible. Studies suggest that more than 1 or 2 days of bed rest can worsen pain and reduce muscle tone and flexibility. Activities such as yoga, chiropractic, massages, acupuncture, or medication with pills and injections for chronic cases. If back pain has left you inactive for a long time, a rehabilitation program aimed at strength training can help you strengthen your muscles and return to your daily activities. Strength training can help the lower back. In push-up exercises, you lean forward to stretch and strengthen the muscles in your back and hips. In extension exercises, you lean back to develop the muscles that support your spine. You should pay attention to exercises that are safe for you. Exercises for lower back pain don't have to take a lot of time. And just like brushing your teeth twice a day to prevent problems, stretching and strengthening your back will benefit you into your 40s, 50s, 60s, and beyond as you age. The muscles lose strength and their spine loses flexibility. Strength exercises to prevent lower back pain. But first, comment if you like this video. First of all, we must identify the appropriate exercises as I mentioned at the beginning in this video. They must be safe and adapted to the condition you present. Exercises such as rowing with dumbbells or in its bar version. If you train in the gym, you have the alternative of seated cable rowing. If you train at home, don't worry. Just having a set of elastic bands is enough to strengthen your back. Being more specific within the lumbar area, take into consideration exercises where the hip generates movements. King exercises such as deadlift with dumbbells or bar, squats in all their versions, and you cannot miss the hip thrusts. The latter, due to the position in which it is executed, directly intervenes in the hip extensor muscles. Like exercises like dead bug, it helps strengthen the affected area. Considerations. Take into account the level of pain you have. Although it is necessary to strengthen the muscles, you should limit yourself to where the discomfort is present. Before taking strength exercises, it is important to warm up properly and have previously done flexibility exercises. Start with a moderate weight in the exercises and do not exceed more than 20 repetitions. Choose an exercise from each one that I showed you. For example, Exercise 1, row. Exercise 2, deadlift. Exercise 3, hip thrust. 3 series between 10 to 15 repetitions with a moderate weight, and as you gain strength and mobility, these numbers can be increased. I hope this information is useful. Thank you for watching the video until the end. Again, I invite you to hit the subscribe button so that I continue showing you more videos like this. See you next time.